favorite.
Thurea and Absalon Kent proudly show me pictures of their son Malcolm, a wrestler, lacrosse, and football player, and the boy who loved his church.
He volunteered at our church with youth programs. He liked to work with kids.
The Kents are a military family who had high hopes for their oldest son. That all changed last January.
He never saw his diploma. They came and presented it to us, but he didn't see that he did accomplish that.
At just 17, Malcolm died at home in Annandale after a 4-year battle with addiction. He had just visited the ER that day after a relapse.
When I went in to check on him the next morning, that's when we found that he had passed away during the night.
Malcolm died from fentanyl poisoning. His parents believe his social anxiety led him to self-medicate. They say he had been in recovery for using vaping and THC products, but his parents told the I-Team they never considered fentanyl until they read his autopsy.
Something that, no kidding, is basically the size of a Tic Tac and will take out your family.
Where do you think he was getting the pills from? Do you think he was getting it from other students?
We suspect it was other kids, but we don't know for sure.
Malcolm wasn't the only teen to die in Fairfax County last year. 4 others did, and there were almost 60 non-fatal overdoses, the highest number in 4 years.
You would hear every, month or two, there would be another one.
Marina Kura graduated from Wakefield High School in Arlington last year, where 2 freshmen died in 2023 of fentanyl poisoning, leading to community outrage and protests from parents wanting more done. Kura says she was so unnerved by what she overheard 2 students discussing in the bathroom after one of the deaths that she reported it.
They started saying stuff like, oh, he was one of my best buyers, and, he must have just taken the whole pill instead of half of it.
What does it feel like to be a student and hearing other students talking about dealing drugs that killed a student?
I think it was kind of a mixture of anger and disgust at the moment, because I was like, how are these people casually having a conversation about selling the drugs that killed a student?
We've seen many who have chosen to take a pill for the first time and not waking up.
In Loudoun County, Jennifer Evans is the director of Student Mental Health Services for public schools, teaching students and their parents how to spot signs of drug use and how to use naloxone.
They walk away with a kit to have on them in their home in case a kid, their own kid or someone else's child, is in their home and they see the signs of an overdose.
What do you say to the parents who say, that's not my kid, that's not my problem?
I would rather you come to have the information, so maybe it may not be your kid, but it might be one of your child's friends, and it takes a village to address this.
Next year, Evans is expected to lead Loudoun County's first planned school for students who want to continue their education while in recovery. Housed in a separate building, they're still waiting on funding.
It's not treatment, it's not an intensive outpatient program, but it would be a school environment with smaller teacher to student ratios.
What is it about what's happening that the feeling was we need something to help kids who are in recovery on their journey?
When you think about someone that's in recovery, one of the focuses is on eliminating the people, places, and things. So you could have lots of triggers that are in their homeschool environment.
I think it's complex because I can't control all the variables.
Fairfax County School Superintendent Michelle Reed met with the Kents and other families who have lost children to fentanyl, sharing some of their stories online, hoping to break through all the noise.
We don't pause sometimes and just take a moment and sit with the grief that surrounds this topic.
Reed says she's trying to direct families to available resources, and her school system is also focused on positive distractions like additional sports and events.
Because we know those are factors that will support healthy mental health and decrease substance use.
You're not going to be able to do this thing alone, so you got to let people know, hey, we need support.
The Kents hope by telling Malcolm's story, one more life will be saved. They say they'll never forget his last night with them and his last prayer he shared with his family.
He prayed and he said, God, forgive me for the pain that I'm causing my family, and I don't want to hurt anymore.
Years after his star turn as Javert in his high school production of Les Mis,
so strong.
Stafford Nibley's mom, Liz, still loves to watch him sing.
Well, look how beautiful his eyes look. And look how happy. He was so happy.
At the time, a high school junior, Stafford was already addicted to drugs, starting with marijuana, then cocaine, heroin, and on and on. It was the start of a years-long battle against the illness. A few years after that musical performance that still makes her smile, Liz remembers dropping to her knees in prayer in Stafford's empty bedroom after he disappeared from yet another drug recovery program.
God, please, please keep Stafford alive. We love you, and give him another chance.
Liz didn't pray for a cure for her son or healing, not even a fresh start, just that her missing son was alive. Addiction rearranges an entire family's priorities.
It's very, very hard. There is no guidebook. And so at times you really feel like you're navigating this journey alone.
It shouldn't be this hard.
Dr. Mark Fishman is a Maryland psychiatrist specializing in addiction treatment. He didn't treat Stafford, but treats teens in what he knows is a tough environment to find care.
When I see parents, they are up to their ears in alligators. They are exhausted. That's the right word. They don't know which way to turn. They don't know what to do.
Fishman just opened Maryland's first inpatient drug treatment center for teens, the first one. There aren't many more in Northern Virginia and none in D.C.
Sometimes, as you say, people are lucky and get it first or second time, but a lot of people flounder and don't know and only get there after a near-fatal overdose, which is way too late.
In Stafford's case, it wasn't the first or second time at treatment.
Like 42.
You found 42 drug programs for your son.
Mm-hmm. All over the country. Yeah.
How do you do that?
I never gave up on him.
It cost hundreds of thousands of dollars even with insurance. His mom says some were better than others. Few had coordinated care at home. Not every family can do it.
We need to do a better job about pushing these treatments out into primary care because that's where kids already are.
Dr. Fishman means a pediatrician, but in most cases, it's not likely a child's pediatrician has experience treating drug use. There is a phone line to give pediatricians suggestions for treating teens, but no formal clinical guidelines to treat it from the American Academy of Pediatrics. Research published in the Journal of the American Medical Association in late February shows nearly a quarter of American pediatricians surveyed diagnosed an adolescent with opioid use disorder, but only 5.5% of them had prescribed the medicine that can save their lives by negating the effect of opioids. And in Virginia, it's against the law to prescribe them to anyone under 16. A law Dr. Zina Saliba believes hurts kids who need the medicine the most.
If there is a young person who's below that age for whom the standard of care or the recommendation would be, let's get you on a life-saving medication, that's not easy to do in this state.
Saliba is a psychiatrist and addiction medicine specialist at the Inova hospitals. She too hears from frustrated and overwhelmed parents and medical colleagues trying to convince them to make sure kids aren't going without treatment.
Kind of a dream state would be that no matter where you enter the healthcare sector, we will help you get to the right place.
And is that the case now for families looking for fentanyl treatment for their kids?
I don't think, not now. That's not where we are right now.
Saliba says not every adolescent needs an inpatient detox or treatment. Sometimes outpatient therapy and medication can be enough, but finding someone who can help direct that care is crucial.
One of the most important things is going to be meeting with a professional who is skilled in identifying the different domains, evaluating to be able to give you a strong recommendation.
In Stafford Nibley's case, Liz thought they had all that.
The poor guy didn't need to suffer. He just didn't need to suffer.
She kept looking for the right combination that would unlock her son's sobriety. But after 42 programs and almost 10 years of fighting, the addiction beat Stafford just days before his 25th birthday. Police found him dead in a Baltimore motel.
Police said there was so much fentanyl.
Leaving Liz his voice and her memories.
So many goodbyes that I said to him that I just hoped always for the future.
We had a very special bond.
Elena Suarez wants you to know her 19-year-old daughter, Colette, the way she remembers her.
She really brought out the silliness in me. She had the world at her feet, literally.
But Colette's world soon came crashing down after a spring break in Brazil took a terrifying turn, where she was sexually assaulted. Elena says her daughter started using cocaine to numb the pain, and when that wasn't enough, fentanyl.
The addiction was fast and hard.
Over the next year, Elena says Colette overdosed 3 times, and after the last one, she promised her mom it would be the last.
Mama, I love you. I want to live. That was one of the happiest moments of my life.
But the happiness was short-lived.
And she's walking out the door. And all of a sudden she turns around. She goes, Mama, you focus too much on me. Focus on yourself. She goes, be happy. And she walked away, and that was the last time I saw my child.
8 days later, Colette died from fentanyl poisoning. Sadly, stories like Colette's are not uncommon. And as we started looking deeper and asking more questions, we found there are even more victims. We're talking about the parents. They're undergoing an enormous amount of emotional distress, not to mention the financial impact they're undertaking while they're trying to rescue their kids.
I was alone with my son in the hospital. I didn't have anyone to help me with the company, so I went bankrupt.
Anna used to own a cleaning business, but when her 15-year-old son Steve started using fentanyl, she found herself juggling between getting him to treatment and just taking care of customers. It literally became a logistical nightmare for her. She eventually had to walk away from her business.
Well, for me, I had to stop working because of a crisis. In other words, it's difficult because I couldn't work and financially contribute because I was taking care of my son. So you lose a lot.
We've actually even seen cases where the family has had to sell their home because of, their child's fentanyl use.
Jonathan Henriquez is with Identity in Montgomery County, which provides after-school resources focused on everything from mental health to substance use for underserved youth ages 7 to 25.
It's a huge financial burden. We provide, rental assistance. We can provide families with, food, clothing.
As parents find out, getting help for their children can be costly. According to the American Addiction Centers, outpatient drug detox programs range in price from $250 to $800 per day. Inpatient rehab programs are even more expensive, ranging in price from $5,000 to $80,000 a month. And then there's the medication. Costs vary depending on the drug, of course, but typically cost a few $1,000s a month. No matter where you live and no matter your financial situation, there are resources to help pay for your child's substance use treatment. Many programs take Medicaid, Children's Health Insurance Program, or CHIP, private insurance, and TRICARE. If you don't have insurance or treatment is still too expensive, there are ways to get help. Many programs will offer what's called a sliding fee scale, which allows you to pay based on your income. Ask about grants and scholarships or charity care, and if it will cover the entire time of your child's treatment, or if you have to pay the money back. Also, some facilities offer payment plans. If you have insurance, first call the number on the back of your insurance card. Ask what type of treatment is covered. Ask them how much your copay will be, how many appointments or days of treatment are covered per year, and if medications are also covered, and how much.
There are more and more resources because the epidemic is so large now.
Elena joined a support group of other moms who lost their kids, sharing their stories, turning the pain into purpose.
I was blessed that my daughter's last wishes for me was that she said, be happy, because that is my guiding light, if you will. I do my best to be happy.
Mami, sama
I miss you so much.
Edith Montalban is heartbroken. She bought this birthday cake for her daughter Ashley, but she's not here to make a wish. She hasn't been for the last 2 years.
When I see her, I say, Ashley, please, mommy, wake up.
In 2022, Ashley died in her bedroom after accidentally overdosing on a drug that was laced with fentanyl. She was only 15 years old.
I don't see a future. You no longer have hope.
Esteban Cortez knows the constant fear of that potential fate. His daughter started using fentanyl when she was 14. Despite treatments, he says she's relapsed 3 times.
I heard many kids had died because of this drug. I was thinking that my daughter was also going to die.
According to a study published by the National Institutes of Health, overdose rates in the Hispanic community increased almost 290% from 2010 to 2021, with fentanyl being one of the main drugs to blame. A synthetic drug that killed almost 75,000 people in the U.S. last year, according to the CDC.
I will never forget my first time doing street outreach, and there was a group of maybe 12, 13-year-olds, and they were cooking up fentanyl.
Nora Morales is a program director for Identity, a nonprofit organization in Montgomery County offering free support to families with children addicted to fentanyl. She has seen firsthand the destruction this substance creates in some Hispanic families already facing challenges and trauma.
Those families have experienced a lot of loss, and when you add the immigration traumas, that is a recipe for a lot of isolation and depression, and so drugs seem very appealing.
In this 2023 report from Montgomery's Health and Human Services, 42% of ER visits for opioid overdoses in the county were Latino youth. University of Maryland professor Amy Lewin, who specializes in the study of family health, says many young people are pushed to drugs seeking some sort of relief from the trauma they left behind or the isolation they feel in a new country.
The journey overland that many of them went through to arrive in the U.S. was, in many, many of their cases, dangerous, threatening, full of deprivation and fear.
Lewin says even if the minors themselves didn't experience that hardship, what their parents went through can impact the children.
I still feel the weight of some of these things because their parents experienced it. So we talk about this as intergenerational transmission of trauma.
She says finding help when it comes to mental health or addiction can be a challenge for migrant families fearful of possible legal consequences.
This is a group that largely has less access to traditional mental health resources because of language barriers, because of income barriers, because of documentation barriers.
That's why Morales says it's so important for parents to help their children find a safe space, especially if they're in a new country.
Help them find a club at school, help them find a church group. A lot of us who are immigrants, we left our communities behind. So if you are an immigrant, create your community by bonding with your neighbors.
In hopes of battling this crisis that's devastating families here and around the country.
It's very, very sad. It's hard. My heart is not accept that happen.
Yeah, thanks, you guys. We're so happy to get together for News 4 Parents today. It's a very important topic, and I'm joined by my fellow parents here, Tracy Wilkins and Ted Oberg, and we're joined by Dr. Mark Fishman. You are an addiction psychiatrist. Thank you so much for coming out and talking with us today. You know, we are parents with kids in all different ages, from elementary school to freshly graduated from college. And I think right out of the gate, the question we have for you is there a particular age that we need to start talking about fentanyl to our children?
I would say it's not just talking about fentanyl. Back up a minute and talk about risks writ large, including other substances that I think of as pre-fentanyl or pre-opioid. So that's nicotine, that's alcohol, that's cannabis. So starting early. So 11, 12, 13, before they've even met those risks is when to talk about it.
I had a conversation with my kids, 1 9, 1 21. Don't take anything from other people. Don't take pills, don't take gummies, don't take candy, don't take anything because of things being laced. How much of an issue is this?
We don't know what's on the street. And what we do know is that things are marketed, as you say, as Adderall, as Xanax, as oxycodone, as Percocet, as whatever, and it's often, if not always, pressed fentanyl. This is 50 times more powerful than heroin, 100 times more powerful than morphine.
My son, who's in college, and my kids who just graduated from college, were telling me that during finals, kids were like handing out ADHD medication to keep them awake. And I'm thinking, you guys know better not to do that. They're like, of course, Mom. But I'm like, do you really? Like,
but obviously not everybody does because there's a market.
Right.
And they trust their friends.
Exactly.
And they're thinking, well, you're giving it to me and I trust you, not knowing 10 other people touched it before that friend got it and gave it to you.
Are there warning signs that we should look out for, along with everything else parents are looking out for?
We know from the data that parents are notoriously bad at recognizing and knowing when their kids have started to get into substance use problems. So the thing to get better at is looking for signs of change and deterioration. What's the decline in the trajectory? They used to be into such and such a fun thing, arts, sports, school, friends, and now they're losing it.
What do you do? I mean, who do you call? Not everyone's going to find you, right? I mean, but who do you call?
Well, I would start with whatever trusted health care giver you have access to. Is it the pediatrician? And don't stop until you get connected with somebody. Maybe it's not a doctor, maybe it's a school counselor. Maybe it's a member of the faith community who's connected to a network of advice. But keep asking and don't give up till you get a yes.
What do you say to parents who say this can't happen to my kid?
Well, that's an error. It can happen to anybody. It is a common, tragic event. Don't assume that you have some force field because of class, because of social standing. It is an equal opportunity evil.
How do you break through and really land when you're trying to have this serious conversation, especially with our teenagers?
You don't need to be their best friend. That's a terrible idea. Let me have a listening ear. Let me be sympathetic. Let me listen to begin with. Never make the mistake that they don't carry your voice around in their heads. Even if they don't follow it immediately, you told them, be careful who you fall in love with and maybe wear a condom. You've given them all of that risk behavior all along. This is the same kind of thing. Stick to your guns.
Can you offer some hope? Does treatment work?
Treatment works. One of the best things I can say to kids and their families is, don't give up on this. There is light at the end of the tunnel. We have effective treatments. Stay engaged. And if it's 3 steps forward and 2 steps back, that's okay. Keep connected, keep coming back, never give up.
Dr. Fishman, thank you so much. And I know that we threw a lot of information at you today, but we do have a QR code for you that you can see right there on your screen. That QR code will link you to a ton of resources and help. So hopefully your kids are watching this. If not, this will also be online so you can watch together. Back to you guys.
Like so many parents we've met, First Lady Suzanne Youngkin admits she didn't know enough about fentanyl until tragedy hit.
My interest in fentanyl was really born out of grief.
In 2020, before her husband Glenn was elected Virginia's governor, a close family friend died of fentanyl poisoning. Grayson Masick was just 21 years old.
I had a lot of learning to do. I didn't really understand the fentanyl crisis. We see across the Commonwealth that very few communities are immune from this issue.
One mistake.
In January, Youngkin launched the It Only Takes One initiative and has traveled Virginia sounding the alarm that just one pill with a few specks of fentanyl can kill, even a one-time user.
Hi, Tracy. It's nice to meet you.
As she met with the I-Team.
I watched the series that NBC and Telemundo were doing on fentanyl.
Youngkin noted the commonality of tragedy in every one of the stories she hears across Virginia and in our investigation.
I was just torn up inside about the family whose young son had graduated, and yet his diploma was delivered to them instead of him.
He never saw his diploma. They came and presented it to us, but he didn't see that he did accomplish that.
As our colleague Tracy Wilkins told us last week, Malcolm Kent was just 17 when he died of fentanyl poisoning at home in Annandale.
When I went in to check on him the next morning, that's when we found that he had passed away during the night.
These sorts of stories, I hope, will motivate people to take action, will motivate people to talk to their young people about this problem.
First Lady Youngkin has talked to her own college-age son, but that's not all. Youngkin knows even with a slight dip in Virginia fentanyl overdose deaths, it's still too hard for families to get help, so she's adding her powerful voice to the chorus, pushing for more.
Are we doing enough in Virginia to treat kids, especially who have this issue?
I don't think we can keep up with the demand. I'm being perfectly honest. But one of the things that practitioners tell us all of the time is that they are semi-designed for substance use disorder among 16, 17, and 18-year-olds. Never before have they seen demand for 10, 11, and 12-year-olds. And that's what we're experiencing in Virginia. And so we have got to do a much better job of figuring out how we can meet the needs of young people where they are with the right help at the right time.